I get a lot of queries from pregnant Indian ladies stating, my husband has got an eye problem or I have got an eye problem. What can I do to prevent that from happening to my child? Suppose I get pregnant now, what can I do? This is a very interesting question, because if you are able to do something that will determine the final vision of your unborn child, that is the most challenging, the most difficult and the most satisfying thing any mother could do. To answer that question, I have to explain about the formation of the eye. The eye forms even before our brain starts to form really well. The eye is almost the first thing that we can actually see in an embryo. After 14 days of fertilization, the eye starts to develop well. It is estimated that it starts by 7th day. At the first 3 months, the eye has developed by at least 80% of the normal size, and the remaining 20% is kept for later, which I will explain later. So the first 3 months, if you notice, is when the maximum development happens in the eye. But all the other organs develop after the first 3 months. They develop well after the first 3 months. So what happens normally in a pregnant lady is, they do not know they are pregnant by around at least 1 month passes before they know they are pregnant. And they normally go to a gynecologist only by around 45 days or 2 months. That is when the gynecologist starts a B complex tablet or a Feefol tablet that contains iron and B complex. As you know, the eye is a very nervous tissue. It is full of nerves, and it develops from the same germ layer that the brain develops. And B complex or B vitamins are very essential for nerves to develop. So if you wait 45 days to 2 months to start that tablet, or if your diet is not adequate enough to contain enough vitamin B, the development of the eye suffers. It is mathematical. So if you are planning for a pregnancy, I would assume that you have to start a B complex or a proper diet when you start planning for a pregnancy, because you never know. When the time the pregnancy test comes positive, the eye would have started developing. So B complex vitamin is very essential for the eye to develop, and you should be starting it when you plan for the pregnancy, or as the first instance that you know that you may be pregnant. Don't wait till you confirm that you are pregnant. At least when you know that you may be pregnant, start it. Because 80% of the development takes place within the first 3 months. And that is when most things can go wrong also. Several infections that happen during pregnancy affect the eye. And they happen during the first 3 months. They are called the torch syndrome, that is toxoplasma, rubella, cytomegalovirus and herpes. So what is toxoplasma? Toxoplasma is a protozoal infection that happens to people who keep pets in their house, usually cats. So when you pet a cat and you don't wash your hand and then go to eat something, or you don't have to eat even, your mouth feels like scratching and you suddenly scratch your mouth, that germ goes inside your mouth. Even if you don't pet the cat and the pet travels across your dining table, that is enough to shed the toxoplasma organism. And that gets into the pregnant lady's system and it travels to the eye, either to the mother's eye or the infant's eye. Most commonly, it goes to the unborn child's eye, and the child is born with one eye blind or both eyes blind. This is the most common thing that we see. But nowadays the frequency is decreasing because we don't keep so many cats in our house anymore. The other is cytomegalovirus. This can be seen as small warts or small white pimples that occur near the eye. Herpes, one variant of herpes is chickenpox. So if you know a relative is having chickenpox or somebody is having chickenpox, I would advise a pregnant lady or a lady who is planning to get pregnant not to go near them. Rubella is also called German measles. All the female children are supposed to be vaccinated against it. In our childhood, we all get vaccinated against MMR, that is measles, mumps, rubella. But we forget to take the booster dose when we are at the age of 9 to 15. That is where the problem happens usually. But India is fortunate to have less rubella cases. And these are the conditions that will affect the eye of the unborn child. So first you have to take care of your diet. You have to eat adequate green leafy vegetables, which is a must in your diet. You must eat small fish, not fried, either boiled or curry. Must eat plenty of fruits. And if you can take a supplement, take a B complex supplement. I will stress that it is a supplement. A supplement means you are adding to what you have already naturally taken. A supplement is not a substitute. And if you don't take green leafy vegetables or other natural sources of vitamin B, and you start taking supplements, that is not a substitute. So have a good diet and take the supplements if you can. The remaining 20% is very interesting. I'll say the eye started off developing within the first 3 months and finished the completion work in the last 3 weeks. So 3 months in the beginning and 3 weeks at the end are very critical. At the 3 weeks of the end of pregnancy, what happens is the nerves of the retina start completing the work. If you see in this, what will be formed will be only till here. The last 3 weeks is when the final blood vessels start to come and they grow outwards. If a child is born premature, there is not enough time for the retina to have blood vessels. So some part of the retina may not have blood vessels because if a child is born 1 month before, it is a preterm child and there is no time for the retina to finish developing the blood vessels. And that condition is called retinopathy of prematurity or ROP. Who are at risk for ROP? Mothers who have taken infertility treatment for getting children, because they are high risk pregnancies and may need to be induced into labor much before time. And those babies have a tendency to be delivered before time also. Underweight babies, it is very significant to note that babies below 2000 grams or 2 kilos are at the highest risk for retinopathy of prematurity. So any baby that is born before 3 weeks or having a weight less than 2500 grams, I would say, has a risk of developing an eye problem. A baby who is suspected of having ROP must have an eye exam next day after birth. It is very vital. Sometimes you might forget or the pediatrician might forget. But I would advise you to remember that. Because what happens in ROP is the nerve does not have blood vessels and the eye has started functioning. So the retina in an emergency starts creating new blood vessels. But they are never as strong as what would have formed naturally. And they start bleeding. And they start bleeding and the retina starts contracting. And the child will lose sight by 1 week or 2 weeks. And there is nothing anybody can do after that. No surgery can help. So it is very vital that we recognize that our child is preterm or underweight. Check the eye immediately. You can suggest to the doctor even, check the eye immediately and make sure that all the blood vessels are there. If they are not there, then we know that the eye will start to make the blood vessels and they will bleed. So we have done laser for children who are even 1 day old, because laser has to be done to prevent that bleeding. That will prevent the blindness. But unfortunately, the child will never have normal vision, because normal vision would have come only when the child is fully term or the birth weight is very good. At least we can preserve 70% or half the vision. That is very great, because otherwise we would be losing that child's vision. The other thing is, we now see a lot of babies who have watering from the eye after birth. Lot of babies. Compared to 30 years ago or 20 years ago, where their incidence would be 2 babies per 100 live births, now it is almost 40 to 50%. Why? As we know, our eye has tears. The tears don't drain out like how we think they drain out. They evaporate, yes. But there are more tears in the eye than can account for evaporation. So the tears have to drain somewhere. So they drain with a tube connected from the eye to the nose. So excess tears in the eye come to the nose, to the throat, and then you swallow it. And the tube that connects the eye to the nose opens only 1 week before actual birth. So any baby that is born before that has a high likelihood that the nose part of that duct has not opened. So whatever tears are there in the eye will go to the nose, will find that the hole is not open, and then come back to the eye. And the eye starts watering. After some time, what tears are there inside that duct get infection, and the eye starts getting pus. So this is what is happening to almost all newborns nowadays, because they are delivered preterm. Most commonly the family is at fault, because according to astrological predictions, they will tell the doctor that I want a child of this star, and that will be 2 weeks or 3 weeks before estimated birthday. This must not be done, because you are compromising your child's eye. And any child who's born fully term has very least or very less likely chances of having an eye problem. It is very vital to remember the first 3 months and the last 3 weeks, because that will determine your child's vision and eye health. As I told you, the first 3 months is when the eye develops 80%. So what should we not do during the first 3 months? You should not indulge in heavy travel, because there may be slight bleeding that can come because of bumpy travel or a lot of stress. Most gynecologists will tell you the slight bleeding, nothing will happen. But you must remember that that is the time that is critical for the eye. We cannot allow for a bleeding that is above slight. So heavy travel or bumpy travel is something you should definitely avoid. Another thing is exposure to X-rays. That is very critical, because in the first 3 months is when the development actually takes place, and we don't want any mutations or genetic transformations at that stage. The third thing that women are likely to ignore is laser. When I mean laser, it is not an eye laser. Nowadays there are a lot of centers and a lot of parlors offering hair removal lasers. It can be in the face, it can be on the body. But you remember, when the eye is developing, no form of laser is to be applied, whether skin lasers or eye lasers or any laser. I would go so far as to advise you not even to go for a laser show. The other thing we have to avoid during the first 3 months is any sort of medicines that you don't actually urgently require. pregnant ladies who are pregnant, you know they are pregnant or they are planning to get pregnant, must avoid alcohol, because alcohol can affect the brain, can affect the eye development. Must avoid smoking. A lot of ladies will now think, I am not smoking. But you must remember, passive smoking is more dangerous than active smoking. So if your husband or somebody in your family or a granddad, whoever smokes, a pregnant lady should nowhere be around. The ideal situation is where you counsel your husband or your family member to stop smoking, so that the unborn child's eye and health are not affected. And medications. And common medications, if you can avoid, it is better avoided.